listening just to start this discussion, listening to the sharing by our panelists in being and given having the privilege of having all of you here from different parts of the world. Thank you for your time. And giving us a brief snapshot of dyslexia in your country and the impact that it is having. Your sharing really demonstrates that while we are very different, I'm sure what Siang's opening remark, I think you all agree, that while we are very different, we're also most alike in our experiences, but perhaps at different stages in our development, right?
It's in fact one of the similarities as Anushka was speaking just now, I straight away took note of, because Anushka, you were saying that even after teaching the children to read, there were other issues impacting them, right? And I think very often these are emotional issues, issues of self-esteem, of confidence, and also great to hear that you guys use the principles of OG with the children. And one of the main principles of OG is to be emotionally sound in your teaching. And I assume that's what you guys emphasize as well.
Yes. Okay. Yes. So when we so our institute is called Institute of Behavioral Psychology. So we just don't work on academics. We also address underlying issues that come with having a diagnosis of a learning disability. So by the time children come to us from schools, they are already in, say, grade 5 or grade 6. They have been held back a year or two in most of the schools that they have been in. They have skipped a number of, or changed a number of schools because, as Tom put it, they said, just have that person out of our school, too much of a troublemaker. So, we've got children coming into us with very low self-esteem, self-image. In many cases, parents also don't understand the problem. They live in joint families. There is a lot of pressure because the cousins are doing so well. And then you have this child who is perfectly fine. There's nothing wrong with them. He's just acting up. Give him 2 tight slaps and he'll be fine. This is the kind of, language that we hear when parents finally bring the child to us. So it's not just the academics, but making them comfortable, giving them that reassurance that they are no different from anybody else, that they can have success, and actually experiencing that success, whether it's in short doses, it changes the perspective completely, and it changes the child completely. When children come to us, they are so scared to express themselves, to give their opinions. And within a few months, when those changes kick in, and they'll be like, no, this is not what I want, this is what I want, and I want this. And, they become very open in their suggestions. So for us, yes, it's a pain, but we feel good when they argue with us like that.
But, it's fun that sometimes we did a project with Latvian teenagers who did not have dyslexia, and we gave them a training in how to explain and advocate for people with dyslexia. And their first reaction was, when we told them what happens, well, that's not fair, And that's the thing is that we underestimate, very often in my experience, we underestimate how supportive peers can be if given the chance. And here's the story. My son and his cousin, who are exactly the same age, they live very far apart, but they're very competitive esports gamers. And somehow in one competition or another, it came out that my son has dyslexia. International people are making fun of him. He won the competition, and then at the end of it, his cousin put it very drolly, you can make fun of him for having dyslexia, but remember, you were just beaten by somebody with dyslexia. So, they come to the defense. And one other small thing is that there's also the family. In our case, we felt so guilty. We felt so horrible about what was happening with our child. And the families that come to us, you know, they're spending 3, 4, 5 hours a night on homework with their child with dyslexia, and they're, whether they want to or not, are ignoring other children. And they feel guilty. The child with dyslexia can feel guilty. The other kids can be really angry. And it's a really, it needs to be dealt with.
I was wondering, Kevin, I mean, the Hong Kong system of identification and intervention is very mature. But are you guys also seeing these self-esteem, these confidence issues with the children?
Definitely. What we have been trying to do, I think for the last few years, and my colleagues and colleagues from Hong Kong, we are now particularly focused on what we call the mental and social emotional aspect. We conduct some research, but we found a couple areas that we think that's important, particularly on student, on self-concept, how you feel good about yourself, how competent you are, particularly related to reading or writing. Those of indicators are important, not just for students with dyslexia, for normal students too as well. And myself and my other colleagues, they also found that anxiety issue as well. So, but older children, students, when they're in adolescence, in high school, so this worry about, if I don't manage to be, a good reader, and I'm really nervous about the whole schooling. So we start looking at those factors as well. We have developed many instruments of assessment, actually pretty much focused on learning perspective. But now I think our colleagues now start thinking more than that. So we're now hoping that eventually, I don't know when, but we do have kind of eventually or some kind of, I would call a checklist or behavior checklist. That may be what I call in stage 1 screening. So that would be part of it as well. So looking at more than just reading and writing skill, perhaps looking into what, if I may, talk about mental related issues. So we still have much to learn from different countries. In the city. So my answer is no, we are still a way to go. And even though we have a system in place in terms of how we identify children with or students with dyslexia, but I think we still have a long way to go. I think if you ask me, I think we only start with the more I call academic skill. I think we're doing okay on that side, but not on the other soft skill. Thank you.
Yes, we've all got to work on that. Mandy, every Australian I've met is full of confidence, right? Especially Deborah Hughes. But I mean, do the SPLD children that you guys have encountered have those confidence issues as well?
Oh, absolutely. So I think this has actually been an area of research that we've been involved in for the last 10 years. And we've been working very closely with the Australian Catholic University, Macquarie University and Curtin University. So there's 3 universities involved in the work that we've been doing. I think one of the things that we identified pretty early on was that although there is some understanding and awareness perhaps, or acknowledgement of, maybe not understanding, not the right word to use there, but an acknowledgement that students with learning difficulties are much more at risk of having what's referred to as externalising behaviours associated with mental health. So behaviour problems, school refusal, some of the things that are very obvious, those kind of external. But what was less understood and is still an area of a great deal of research is the internalising issues that for a lot of students develop as a result of poor reading in particular. So those kind of internalizing issues such as depression and anxiety and just kind of switching off. So they're often hidden, and sometimes they're almost ignored because the student is not causing trouble. And so they're quiet, they're at the back of the room, they're kind of fiddling things. People decide they have attentional issues, but actually it's just that they can't really keep up with what's going on because they can't read. So, you know, I think this has been a huge area of research for us over the last decade. And the work that we've been doing with Clever Kids, which is very much about teaching positive coping strategies, has kind of shown that the kids continue through into early secondary. It was a really important point I think Tom made about that transition into secondary. It's a key time for these students. It can kind of make or break them, quite frankly. And into secondary, we wanted to set these kids up for success as they moved into secondary. So teaching some of the more positive coping strategies and teaching how to reduce the negative. The independent research we've done on that has shown quite a significant impact, but there's a long way to go. So I think it's a huge, huge area and one that we're really quite concerned about. I'm just going to connect to that with John Hattie's work, which of course, for those of you who would know John Hattie, I think, you know, he's done a huge amount of work in looking at achievement. And I think this kind of idea of which comes first, the kind of horse or the carriage in terms of success and feeling more confident about being in an environment, an educational environment, the research is pretty strong that if you can help a student begin to believe that they can be successful, and in fact, not only believe that they can be, but that they are being successful because you are giving them those opportunities of success, that in turn builds confidence, that in turn builds the desire to, okay, I'll keep going a bit longer at least and see where this takes me. That is a more powerful route, to be honest, than the alternative, which is trying too many of the kind of engagement activities in the hope that that will then eventually lead to success. So his work is pretty powerful as well. Yeah.
Thank you. Thank you, Mandy. We've got lots of questions coming through, fast and furious. So I'll try and maybe start to go through them for the benefit of our participants. There's a question here which perhaps maybe Kevin might answer, or one of you. It says, different countries adopt different approaches in requiring a diagnostic evaluation looking into IQ and other achievements, but these come at a cost, so it's expensive to have assessments. How can we break this for it to be used as a facilitator and not a roadblock for remediation and intervention?
Earlier, I presented my wife's research about development of a tool for assessment of fluency in fourth-class students, which is a very simple tool. And we actually, forgive me, in this room I probably should not say what I'm going to say, but we fought against early screening tests because there was no remediation to follow it. So what's the point of doing a screen if you don't have good remediation to follow? But the teachers, we meet so many teachers who care so much. And so our perspective is we've given up on this. So we're going to be here. We're going to give tools to teachers so that they can at least say this, understand that this child is really struggling, and we give them a tool that helps them to understand some areas that they're struggling in with reading, specific mistakes that they can work on, etc. We're going to give them this tool, and then we're going to help them to learn how to use that tool because we know there is nothing else really there at the moment. So we're here. We're going to do this. Our academics have created a couple of tools, but yeah, like they're very privatized. They're very expensive. Psychologists are very busy people. We understand that. So we're going to focus our efforts here, and we're going to hope that the rest of the system catches up.
Okay.
I was just going to jump in and say just as a follow-up to that, we are currently working with a couple of universities on developing a thing called the BARD, which is the Brief Assessment of Reading Disorder. And I mean, not to be confused with Shakespeare, but the notion that students do have to go for this long psychoeducational assessment brings with it so many problems, and least of which is the inequity associated with that. So we've done over 15,000 diagnostic assessments over the past number of years, and they're full psychoeducational assessments. What we're currently doing is working with a really good data analyst in Canada who is pulling out from those. Well, actually, we're working with 10,000 of those cases because the previous 5,000 were a little bit old. But the 10,000 cases, the recent ones, and he is identifying the most powerful components of these assessment tools to say, really, you get the same power by just doing these 3 short tests as you do from doing the whole battery. In terms of that still continuing to meet DSM-5, we're working very hard to ensure that it will, but we're making it much easier and much more accessible, and we actually think it's going to be a bit of a game changer.
Thank you so much. Siang, I think there's a question here for you.
Actually, I would like to follow up on this question and linking this back to what Geeta was saying earlier this morning. Do we have to wait for the diagnosis before we provide the intervention? And really the answer is no, right? Although there are these differences in the screening and assessment processes from different countries, I do not feel that that's as critical, right? But which is not to say that assessment is not important. The assessment is important, again, not for diagnosis per se, but how can we better understand the child, and therefore how can we help the child? And if the screening and assessment process is doing that, I think then that's fine, right? And again, because of that, even if there are differences, it doesn't matter if we are better understanding the children and we are able to better help the children. You wanted to add to that, Kevin?
Yeah, definitely. I think that's very important. I think assessment is one of the formal assessment important, but one thing is assessment for learning also important. So it should be happen not just in class as well. So that's what we have teacher training program to have, like, identify, observe. Basically, you can do in your classroom, you can observe how many students, kind of like in your classroom, you have 20 students that when you look into your classroom, there at least some of the students will be a bit weaker. So you start doing some work on doing some classroom intervention. I think that's important. Just don't wait until you have to get a formal assessment. To adjust quickly on that point, from Hong Kong perspective, this is why I want to present earlier that we have 2 stages of screening. The first stage is basically all those tools are free for teachers and parents to use, most of them. So those tools, basically, it has local norms, so the teachers can actually do a self-reporting. Some of the measures that teachers may need to conduct, a couple of simple measures, like look at word reading, word spelling, and a couple like what I call orthographic knowledge. So teachers can conduct this in school based on their class situation. Basically, because the student spend a lot of time with the teacher, so the teacher will have the very professional way and looking, okay, I believe Kevin is at the risk, so you can try those assessment. So in other words, you don't have to wait until you get a formal assessment. So all the learning should happen in the classroom. So the teacher training, teacher knowledge, teacher preparation program are important. So thank you.
Yeah, continuing with what you were saying, we actually have a question regarding teacher training. And so the question is asking, Kevin mentioned that your teachers fully receive fully sponsored training. to better understand. The question is asking if the DAS is perhaps advocating for this policy. Free teacher training.
I think when Kevin says free training, that's also linked to what your government is doing, right?
Yes. That's right.
So the DS is not the government, although
Yes.
the Singapore government obviously has been, and through our Ministry of Education, has been very supportive of our work, all right? And I know that within the MOE system, there's a lot of available training to the Ministry of Education teachers, right, to access training in terms of special needs, including dyslexia, right? And of course, at the DES, you guys know we have a subsidiary, the DAS Academy, right? Which provides various types of training. Some of it is subsidized. I think, hopefully, currently some of it is can be co-funded by Skills Future. There is a degree of funding for various training. I hope I answered that question.
Yes. Okay, I think 2 more questions. Yeah. This one is directed to Mandy. And Mandy, the question is Aboriginal. Okay, so Aboriginal people generally have no written language. That's the question. So dyslexia would have traditionally been alien to them. Okay. What was the driving force in teaching them English, which then results in the need of intervention for a problem they never knew they had or affected them?
Whoa, that is a deep question. I think being realistic, Aboriginal children are amongst many children in Australia who come into the classroom not necessarily speaking English. We have a huge kind of culture in terms of a multicultural population. And in some of the schools I go into, there are 47 different languages being spoken. It's a young country and it's a very multicultural one. So to kind of not teach Aboriginal children English, I think would be highly discriminatory. I think English is, or having a written language, doesn't have to be English, but having a written language and being able to read is a very, very powerful asset to have. And in any way kind of denying any kind of group of people. And I know that's not what the question was suggesting, but I think that the reason for providing an education which will include learning how to read and write to everyone and all children who live in a country is critically important. The written language that is used in Australia across the population is English. And so providing students with access to that is critically important. I think I'll just add to that though, in that I think that I would actually say, and this is going to potentially would require a much longer answer and more kind of expansion, but I think I could probably count on one hand the number of Aboriginal children in Australia who have been diagnosed as having dyslexia. So, and the reason for that, it's twofold. One is that I think when you're going into some of the very remote communities, identifying dyslexia is really a long way down the list of things that are seen as priorities. So I would be saying that what we're trying to do is provide teachers with the skills and knowledge and competencies to deliver a really first-class teaching program in those schools with those children, and ensuring that they are confident and successful learners. Number one. The second thing I will say is that Aboriginal people, as a community, as a culture, don't like the notion of disability. So anything that kind of suggests that you're going to be doing some kind of assessment that might identify a disability or a disorder or a difference is not actually seen in a very positive way. And so again, it's something that we steer clear of, to be honest. And I would just simply say that it's not a priority. The priority is providing a high quality education system for these kids. I hope that answered the question.
I hope that answers someone's question. There is a question that for the general panelists, because listening to Tom on Latvia, I was suggesting, how can we, coming from countries which, although not perfect, we have much greater support for work with dyslexia. So how can we help our friends in Latvia? Perhaps I'm just suggesting, and maybe, you could have better suggestions, but maybe a virtual conference,
And I know that the way that I talk about it comes off awful. Please do not think of us as just wallowing in the mud and just trying to follow our way through. We have problems, and we see there are a number of us who see ways through it. Honestly, it's not as though we don't see the structures we need. It's not as though we don't understand the systems that we should have in place. We know the people we need to convince. The thing is that over time, we need to continue to do what we've been doing, which is when we have the money, we bring in the expertise that we need in order to do the things that we can. We leverage every opportunity that's available, like the Fulbright senior scholarships, for example. Nobody had ever used them in Latvia for what we used them for, which was bringing in master's level expertise to teach master's classes to reading teachers, right? That was extremely helpful because it got 200 reading teachers exposed, right? It's not a critical mass yet, but it's there. And as we see the future. And the greatest help is that if we knock on your door or send you an email, you say, sure. And then I think that's true of everybody,
That's right.
because we all have something to offer each other, I think.
Xiang, something to say?
And I think one of the best things we can do is, in fact, to have forums like this.
That's right.
Right, whereby clearly dyslexia is a global issue, right? And every country has our fair share of challenges, and we are all trying to overcome, and we can learn from each other.
Deborah says we need to close.
Yes, the Australian
Our
is telling
time,
us
yeah,
to stop.
timekeeper.
Okay, if I may just end off with this. Some people have asked me, so why don't I see more of this book that you are talking about? The International Handbook of Dyslexia in Education. And we didn't really want to emphasize it because we wanted the emphasis to be on the countries, on what they have been doing, the challenges and their successes, and how we can work together to further promote dyslexia all over the world. But if you are interested to read up more, this book, the link to this book has now been put onto our website. If you go to the International Forum page, right, the link to Routledge is there, and you can go find out more about this book and read up more about the stories and the work of all the panel that is here right now. All right, thank you very much.
Oh, Deborah, on behalf of everybody, I'm sure that I say thank you for staying on top of everything with all the emails and reminders. Thank you.